Hi, this is Dr. Fred Macy, cardiologist. I've been asked to speak about how to treat people with lipid disorders. First, I'd like to say that we cardiologists have been dealing with this topic for over 40 years. And I'd like to first speak about those at the highest risk. That is, those who've already had a heart attack or a stroke, or those who've already had a stent or bypass surgery, or have peripheral arterial disease and or atherosclerotic burden in other vascular territories such as the carotid arteries in the neck, the aorta, or, as I said, the lower extremities. These individuals require lifestyle modification. That is, the Mediterranean diet, predominantly plant-based, a limit on saturated fats to no more than 10% of total calories, and a limit on sugar consumption. In men, I'd like to recommend less than 36 grams per day, and in women, less than 26 grams per day. In addition, avoiding all cigarette or contact with tobacco products at all costs, since tobacco is a huge risk factor for promoting progression of atherosclerotic burden. Lastly, medications. Patients need to be at an LDL less than 70 milligrams per deciliter to prevent progression of disease, and that is usually acquired with high-intensity statins such as rosuvastatin or atorvastatin. Okay, so sometimes other drugs are needed, such as ezetimibe and omega-3 fish oil capsules. That is the way you treat high-risk individuals. How about individuals who are at a lower risk? Who are these? Well, those that don't have hypertension, diabetes, prediabetes, or a strong family history of premature cardiovascular disease. This is where the controversy starts, because these people are in primary prevention. And so recent meta-analyses have unfortunately demonstrated that the benefit that you get in treating, say, for 5 years with a statin, 83 individuals, you might prevent one death. And if you treat 36 individuals for 5 years with a statin, you might prevent one heart attack. So these numbers are not impressive. And if you were to ask me, how many extra days of life do you get if you treat a primary prevention individual, as defined previously, with a statin for life? The answer may surprise you. 4 days, maybe, by taking a pill for the rest of your life. So in the primary prevention arena, I personally advocate to adhere to a healthy diet, such as the Mediterranean diet, and an active lifestyle every day with activities that bring down your stress, that optimize your sleep pattern by sleeping uninterrupted 7 to 8 hours each night, and by having a connection to your community that allows you to thrive and be happy. So that's my message for today in this incredible controversy that is raging at this moment in the cardiovascular world.